All right. Hello, everyone. Welcome to this interesting session. My name is Roberto Hernandez Alejandro from University of Rochester. The topic that we're going to be discussing today, it's about developing programs, liver transplant programs worldwide. And I have an expert panel here with you, Dr. Alfred Cao from Singapore. He is from the National University Hospital, is with us today. Dr. Nicolas Goldaracena. He is a great surgeon, also working at University of Virginia in the US, and Dr. Prashant Bhangui from Medanta NCR in India, Delhi. So having introduced our panel, we're going to start creating some questions that I'm going to be asking our panel. And please, I ask all of you to talk and to ask questions in the side chat bar. I will see those questions, and if we have time, we will be asking those questions to our panel. So in order to start, I would like to start asking each of them if they can describe what is the situation of organ donation in their own areas. For example, Dr. Alfred Cao in Southeast Asia, Nicolas in Latin America, and Prashant in India and the surrounding areas. Can we start with Alfred?
Right. Thank you, Roberto, for the nice introduction. Hello, everyone. I'm just going to take the opportunity to introduce the what we would say perhaps the scene of liver transplantation in Southeast Asia. Southeast Asia essentially is a group of countries situated around the Southeast Asia region that ranges from, for example, up north Myanmar, Thailand, Laos, Cambodia, Singapore, Malaysia, Thailand, Brunei, and the Philippines, and Indonesia. So overall total population is about 674 million people. And if we were to talk about mature liver transplant centers, countries, region where we say estimation of meeting the liver transplant need should be about 10 to 11 million population, the cases that we have done in Southeast Asia is certainly much, much lower compared to the rest of the mature where liver transplant cases are matured in those areas like Europe and America, and even the Northern Asia and South Asia region like India. There are a few centers scattered around different parts of Southeast Asia. Perhaps the most mature one is in Singapore. We have two in public hospital and one in the private hospital, liver transplant centers. In Thailand, there are 4. Situated mostly around Bangkok and slightly where it is on the eastern coast, the Khon Kaen region, as well as up north in Chiang Mai. Myanmar has just started one center with the help of the surgeon from Korea. Indonesia, in Jakarta, there's one center with cases that's usually done with the help of external experts. There are 4 centers in Vietnam, 4 centers in the Philippines, all situated around Manila, 2 in Kuala Lumpur, and there's one that's actively doing live donor transplants since 2 years ago. But there's none in Brunei, Cambodia, and Laos. I think overall, the number of cases done in the region is really not enough to meet the needs. I think there's a lot of challenges there, partly situated mainly around the problem of, for example, the funding of the healthcare structure. At the same time, also may be related to skills and capabilities, which we definitely can grow with education and training. Public awareness and patient perception too seems to be getting better now, but I think there's a lot more work that needs to be done to grow the public acceptance and trust that liver transplantation is the correct treatment when the patient requires them. So roughly that is the situation in Southeast Asia. Yeah.
Thank you very much, Alfred. Nico, can you illustrate us briefly of what's happening in Latin America?
Yeah, I think it plays along a little bit with what Alfred was saying, you know, and Latin America encompasses like a big amount of countries from Mexico all the way south to Argentina, no? And I think that they all have, all these countries, similar situations, but at the same time, all the realities of each one of these countries is different, no? We have countries with huge populations like Brazil, with 210 million, and down to Bolivia that has, for example, 1.1 million population. No? And the application and of transplant and what has been going on there, it all comes down to what transplant rates they have. They usually have very low transplant rate. Their donation rates, although in some countries have been increasing, like for example in Argentina, given some new policies and so forth, to up to a rate of like 19.6, the transplant rates have not increased. No, so these countries are not meeting their the amount of transplants they should be doing, you know, based on their populations. I think all comes down to problems with very different healthcare systems, access to healthcare, the socioeconomics of these countries, the education, and so forth. I mean, if you look at the transplant in Brazil, started in 88, no, and there are countries that they even started earlier. Sorry, Brazil 68. So they have been doing this for a very long time. They all train. Most of these transplant centers come from people that started training either in the US or Europe, brought back this knowledge, but then they have a lack of maybe infrastructure and so forth to be able to be successful in this sense, no? And there's several, like a lot of limitation, not only in policies, but the application of, for example, certain type of, there's no country in Latin America doing nowadays DCD organs, no? Despite having a increasing rate of disease donation. And there are some countries doing living donors, and that technique is there, but the application it's not that high, no, when maybe it should be. So I think it's a common denominator in for example, what Alfred was mentioning.
Excellent, thank you, Nico. Prashant, can you illustrate what's happening in perhaps India and surrounding areas? And if you can extend later on, starting with the second question, that will be, what strategies you have seen around the area or with other societies that are working on trying to implement and increase organ donation in this area?
Yeah, thank you, Roberto. So I would concentrate probably on South Asia, leave apart the Southeast Asia and probably Korea, Japan, that part of Asia and South Asia. So if we were to talk about this region, I think India obviously is doing around 1,500 transplants a year. About 85% of those transplants are living donor liver transplants, whereas 10 to 15% is diseased donor liver transplantation. But since we are talking about developing transplantation in countries that need it and do not have the infrastructure, I got in some figures. And if you were to think of our neighboring countries in South Asia, so Pakistan, they do somewhere around 390, close to 400 transplants now a year. That's the number in 2020 that they had, and they started from 2016, somewhere around 190 per year. All of them are living donor liver transplantations. If you come to the south of India and Sri Lanka, all diseased donor liver transplantations, except for one pediatric they have done. But from 2016 to 2020, the total number of transplants that have actually happened in that country is not more than around 50. So they started with 2 in 2016, and they're up to 11 now in 2020. If you talk about Nepal, slightly to the north of India, only around 12 living donor liver transplantations till date, and they have done that with the help of surgeons traveling from, say, India or from Korea. Bangladesh, which is again a neighbor, only 6 cases till date, all LDLTs. And remember, all these countries have numerous patients coming to India or to traveling in order to get transplantation. So the need is high in these countries, whether it is Pakistan, whether it's Nepal, whether it's Sri Lanka, whether it is Bangladesh, and they travel to India to have their transplants because of the dearth of developed centers in their country. And they really want to develop. They want to increase the numbers because there is a need. I would also talk and include Russia because it's a very close neighbor of India and a huge population which needs transplant. And again, they started off, if I look at the last 5 years, I think in 2016, around 400 transplants, gone up significantly. 2019, they did about 600 transplants for the entire country, but it's a huge country and the requirement is huge and this is not enough. And all of them have been DDLT, except for 30% they say are pediatric transplants, which are done as living donor liver transplantation. So to your second question, Roberto, I think what we have been trying to do, Roberto, of course, leads our education and scholarship committee of the International Liver Transplant Society of the ILTS, and we are actually members, myself and Alfred. And the education and scholarship committee actually started off an initiative with the help of the Executive Council, who was also very keen on it, called the REAL Initiative. That's a regional expansion of advanced learning, where the main objective was to target areas of the world where there was a need for developing liver transplantation, but they did not have enough number of transplant centers which were available and were up to the standards to give that amount of care. So we targeted basically 3 areas: Southeast Asia, as Alfred has already mentioned, South Asia, that's the Indian subcontinent, that is India's neighbors, and of course, that team is being led by me, and Roberto is heading the team which is looking after Latin America. So there were basically these 3 regions that we took under the REAL initiative. And if I call it all in threes, we had 3 major objectives. The first objective was we actually did a real survey of all these countries, especially directed to these particular areas, to see what was their need for liver transplant education, for infrastructure building, for mentorship, and whether they were interested in us doing this particular program. And the responses were exhilarating, I can say. Every country, the responses that we got from these regions were they really wanted ILTS to participate. So propelled by that, we went on to 2 of our other objectives. One was the state-of-the-art lecture series, which we started in December, with pioneers in the field addressing topics like evolution of liver transplantation and also personalizing immunotherapy and HCC management in patients. These were the state-of-the-art lecture series, which we plan to continue during this year as well. And then in the 3 different zones, we had regional webinars, which were basically open to all who wanted to participate in those regions. We reached out to them, and we started this in February 2021, plan to continue the same, and very good response. We've had more than 300 attendees in every webinar, whether it was Southeast Asia, South Asia, or Latin America. And then there are 3 key areas which we think are very important. To stress the fact that education is extremely important to develop a program. Number 2, that multidisciplinary team building is extremely important, and infrastructure building is extremely important for these regions or countries which want to develop liver transplantation.
Thank you, Prashant. This is great, and yes, this REAL program it's growing, and I think it's starting to have significant impact in these regions. So I encourage people to join us. Alfred, what can we do in regarding organ procurement, establishing brain death legislation in some countries? What obstacles do we have? How do we have to work with institutions? Do we need to get into government? How can we do to increase organ donation in some places?
Right. Thanks, Roberto, for that question. I think it's, like I mentioned at the beginning, it's important to take into the cultural and religion background of the region because, for example, in this whole Southeast Asia, we have a multiracial society with various people with different kinds of religious background and also cultural background. So organ donation is generally frowned upon by some people because of the belief that they want the whole body, particularly from the deceased donor organ kind of perspective. They want the whole body to be intact when someone passes away. But I think the concepts are definitely changing. And so that's why leading countries in the region where there's slightly more organ donation activities like Singapore, and in fact, Thailand actually also has a lot of organ donation rate, particularly situated around the Bangkok region. Because of the religious belief, Buddhist society is largely the religion that's adopted in Thailand. But what happens in some other countries where I think from the religion perspective, the mindset and the awareness needs to change. So I remembered one session where during the state of the art lecture where Yaman shared his experience of building liver transplant program in Turkey. And because Turkey is a Muslim country largely, and there were audiences who came from the Indonesian region who posted the question of how to then can they work on increasing organ donation from the religious perspective, because certainly legislation in the country is tied closely with how the religion and culture is in the society. So I think with more and more people in the region now being aware that transplantation, particularly liver, is able to help to solve key treatment, and it's actually the gold standard in many of the end-stage liver disease, including liver cancers, then certainly the positive image of organ transplantation, number one, success rate of organ transplantation, number two, the long-term good outcome that's being shared with people in the region will start to now give a positive image to organ donation and transplantation. And that will certainly encourage not only legislation, but people who are willing to come. If you have people who want and government who is willing, then I think that will definitely solve the problem. And one very unique initiative that is started by the Malaysian team in the Southeast Asian region based in Kuala Lumpur is by one of my friends, Dr. Kong in KL. It's called the Organ Donation Initiative Strategies for Southeast Asia. Actually has successfully introduced a lot of educational activity and knowledge to organ donation, disease organ donation. And this is in collaboration with the Spanish liver transplant group as well as the Italian, who introduced the concept, and now they are actively promoting in a public arena for people to donate organ. From the legislation perspective, I think that has certainly helped, because with the people accepting more of it, and at the same time, the government's actually aware the importance of organ donation and transplantation. Now you get the politicians interested, because then they can influence the governmental policies and provide a little bit more financial support and infrastructure building for organ transplant activities. Yeah.
That's great. Thank you, Alfred. Nico, there is a question in the chat, very interesting. Dr. Akanand, seeing he's chatting and telling us from Nepal, saying that they did their first successful live donor liver transplant with the help from one institution, Apollo Hospital from New Delhi. So my question to you is more about, in these regions and areas where there is not much implementation of organ donation and cultural problems, is living donor liver transplantation the answer? Is that what we have, the way that we have to move? What is your opinion on this?
That's a great question, and I don't know if I know the answer to that. I think what these countries need to do is basically approach all potential organs that might increase the availability of grafts, no? And it's not that living donation, for example, in South America has not been done, and actually it's active. There's active programs over there. Most of them are into pediatric recipients, not that much use in the adult population, but this is not easy to implement. No, one of the main problems that it has, and it's reflecting on the deceased donor side, is there's a very high refusal, and probably is the main limitation, very high refusal to donate, and that's based on beliefs, and not religious, but just beliefs on misunderstanding of how this works, how donation works. And also in this sense, it's very difficult to sell that idea for donating a ride load, for example, for an adult. No, so it's not easy to implement. Although I do think that this is probably the way to go. No, it's probably easier than implementing DCD grafts nowadays in South America, and this has been really well shown by the Universidad Católica in Chile. No, they have a very high mortality rate. No, almost 35% mortality rate, and
on the waiting list, I guess.
On the waiting list. And the donation rate is very low, and they're pushing a little bit the envelope on the living donor side, and I think quite successfully. So we can learn from them as well, no? In that sense.
Excellent, thank you, Nico. And I agree with you that in certain places this is the way to go. Prashant, you work in an extremely busy place. You're constantly, probably you're coming out from one living donor right now, and then just jumping into this conversation. Having that experience working with that many surgeons, hepatologists, what is the benchmark for centers? There's always small centers around your center or in other countries where they have a low volume. I don't know what is the benchmark or what we call low volume, depending on where you work and those things. But do we need to centralize thing? Is that better for centers, or could there be several centers doing small, medium-sized volume? Do we need to have a benchmark to say, if you do these volumes or if you have these outcomes, these metrics, is that what we need?
Thanks, Roberto. I agree that this is the day and age of benchmarking. We have benchmarkings and in everything now. You know, there are studies and papers being published on benchmarking living donor outcomes, what the donors should achieve, everything. But I think that there are pros and cons of both the things: small or low volume centers and high volume centers. See, the benefits of low volume centers are, given the wide diversity in the type of societies that we have, there is sometimes a need of low volume centers in areas probably where you have a high proportion of organ donation. For example, if you were to just take India as a country, or you were to take the surrounding regions in South Asia, there are some areas where even in India, the north of India is not great for organ donation, whereas the south of India has high organ donation rates as compared to the north. So even if you were to have 5 or 10 centers in 2 or 3 states in the south of India, if there was an organ donation, actually that part of the society may be serviced better if you were to have larger number of small volume centers there. Number 2, if you were to ask me for a benchmark, I think a high volume or an adequate volume center in terms of safety and in terms of outcomes probably would be 50 transplants a year. At least I can say that in our part of the world. High volume, of course, we have centers who are doing it like ours, 300 transplants a year, but that's a different set of centers. If you were to think of large volume centers and centralizing them, of course, there are benefits. Your outcomes would be better. You probably have much better in terms of long-term survivals. Your access to multidisciplinary care is better. But I think somewhere when you want to develop liver transplant programs, you should be able to achieve a balance between the two. There should be some definition of the minimum infrastructure and minimum qualifications and minimum requirements that are there should be definitely. But in terms of number, I'm not really sure whether it should be just the 50 number or the 100 number or the 20 number. Everything else needs to come into play as well, I think. So there are pros and cons of both.
Really, that's true. That's true, Prashant. Very interesting, very good discussion. I'm enjoying it. Alfred, you in your center you do both, right? And in Singapore you're doing deceased donors, like donors, and you play an important leadership role in your country in liver transplantation. There was one of the questions in the bar of the chats You know, the one that they said we did the first one in Nepal with the help from another country in India, or other centers, for example, they're talking about in Brazil about, despite the complexity and the infrastructure in some places in Latin America, they were able, there are 50 liver transplant centers, and then they doing around 2,000 liver transplants. So that's impressive, that's good. Hopefully they are even, perhaps that's not happening. And already Prashant already talked about that thing of volume, but how important is to support between institutions that has experience to the places where they want to start. How do we do that? How we help them? Is there any way that, you know, is like education is part of it? That's why we're doing real, right? But what about hands-on? What about and it's not only the surgical part, right? What about the training of nursing and anesthesia and the rest of that? What is your opinion on that aspect and the support that some centers should give to other centers from other countries?
That's an extremely important question we have asked, because it's to build capacity and capabilities for centers in the region. So for centers who are just starting out, I think it's important to recognize if there's any nearby good centers or big centers where the volume is sufficient for training. And the training, as you mentioned, Roberto, is really not only focusing on the surgeons. It has to be also with the hepatologists, the nurses, the coordinators, infectious diseases. And why is that important? It's because when someone is starting out, if you have a difficult case, you want someone nearby to discuss whether you should be doing and how to do so, and perhaps discuss the technical part and even the perioperative management of that. And at the same time, with the nearby situation, for example, if the case is difficult or challenging, for example, recently we just accepted a patient from Kuala Lumpur up north in Malaysia, where the patient has acute liver failure and has MELT 40. And perhaps they were not comfortable to handle such a challenging patient. But with experienced centers like ours, which is nearby, just less than an hour of flight, we could transport the patient to our center to do the transplantation. And vice versa, if it's allowed, and actually we have very good collaboration with centers around the region, then places where there's experienced surgeon, then you can travel out to then help to do the cases there as well. And I think all this can be pre-established with collaborations, and at the same time, then we get medical registrations, and we will allow each other to then travel and help each other. And in that way, we don't only transfer skills, but knowledge and build collaborations and network. And that's certainly one of the important ways to grow over and above the rest of the trainings that's been done, because we do have hands-on workshops that we do regularly pre-COVID annually in our place. And we can also travel out to conduct workshops in various places where they are interested to increase the awareness and activities for liver transplantation. That certainly will help the region to grow.
Perfect. That's very important, and thank you, Alfred. Well, we just have 1 minute last. I just want to conclude this. Say thank you to Dr. Bhangui, Dr. Cao, Dr. Goldaracena. This has been a fantastic talk and conversation. The ILTS is working with the REAL program. We are working also with the TTS on developing, sharing and communicating with other centers who are in developing, and I am part of that committee, and it has been quite interesting to be part in all these initiatives of helping programs to move forward. And thank you to the ILTS, and thank you again, everybody. Enjoy.
Thank you, everyone.
Thank you.
Thank you for sharing, Roberto.